Towards death and dying, chances are you have an uncomfortable reaction. And that's natural, it's an uncomfortable topic. But the sad truth is that we all have to deal with it eventually in some capacity. We all want this process to be as pleasant and positive as possible, with minimal negative impacts upon the mental health of the dying individual and their family, despite its uncomfortable nature.
In Ontario, there is a serious problem for how we deal with death. Studies have consistently shown that individuals that die in hospitals face significantly higher rates of mental health issues, such as depression and anxiety, than individuals that die in home or hospice. Hospitals primarily focus on the prolongment of life and treating people to get better, which should not be the greatest priority when dealing with terminally ill individuals. At the end of their lives, dying individuals need comfort, counseling, mental health supports, and their loved ones by their side in order to properly prepare for death and ensure the least negative mental health impacts upon them and their families.
Luckily, there are other options that do just that. Research shows that hospice dying produces significantly better outcomes for the mental health of patients than hospitals do. Not only do hospice and home deaths foster a more welcoming and supportive environment, there's also significantly cheaper than hospital deaths. And the fact is that the vast majority of Canadians, 83%, express desire to pass away at home or in hospice, yet only a small fraction of that number actually do so.
So why isn't hospice and home deaths the norm in Ontario? The unfortunate truth is that our medical system simply does not prioritize the mental health of patients that are terminally ill. Hospitals and home deaths are underfunded, which has led to a lack of available beds, specialized healthcare practitioners, and support for individuals that wish to enter hospice or receive home care support.
This is where our proposed solution comes in. Ontarians for Hospice and Home Dying, OHHD, is a not-for-profit organization that we've created with the goal of promoting hospice and home deaths in Ontario. OHHD will address this goal through a two-pronged approach over the coming years. First, we'll focus on educating the public and raising awareness and support for this cause. We'll start with an online information campaign through our website and social media, educating Ontarians on the benefits of hospice and home deaths. We will become registered as a not-for-profit organization and gain grant funding in order to spread our message. Moving forward, our goal will be to influence policy on the level of provincial healthcare funding. For this, we will need your support. We will create an online petition in order to make it clear to legislators that Ontarians want more funding for hospice and home deaths.
In the second phase of our campaign, with the support of the public behind us, we will create a policy platform and lobby the Minister of Long-Term Care and Health, Christine Elliott, to implement our policy goals. Hospitals in Ontario receive over $20 billion in funding every year, and yet currently only $35 million are invested in hospice in the same time frame. OHHD's goals are to shift a small portion of healthcare funding that goes towards palliative care in hospitals towards hospice funding. With this funding, we will close the gap between the public's desires to die in hospitals and homes and the current lack of resources that prohibit them from doing so. We will also seek to implement changes in the healthcare field to place more emphasis on training and empowering nurses and doctors in palliative care, as currently only 3% of Canadian healthcare practitioners specialize in this field.
With your help and support, we can help open the discussion about this uncomfortable topic and make more Ontarians aware of the benefits of hospice and home deaths. And more importantly, make these services accessible to Ontarians that desire them. Together, we have the power to improve the mental health of individuals and their families that are impacted by terminal illnesses. Thank you.